You see all sorts here, so everything from paediatric patients to cardiac patients to dialysis to even a bit of theatre, which you just don't get in the Metro Hospital. Usually you're confined to your one area, where here you can sort of see a bit of everything and really build up a solid variety of skills.
We get your lumps, bumps, scratches. We get your traumas, head injuries, motor vehicle accidents, so quite serious, urgent care that's required.
We've got 36 beds in this whole ward, which is split with maternity, with a bit of paediatrics and palliative care thrown in. We have less surgical patients than we had before, but we probably have more medical patients, older aged medical patients. You might see them 2 and 3 and 4 times, you might see them in the community. I think it's a bit more personal.
In the Southern District, Narrogin is the hub hospital, so a lot of the smaller sites in the smaller communities outside of Narrogin feed into the Narrogin Health Service. So if someone was presenting at Lake Grace and they needed further management, they might come to Narrogin if they didn't need to go to the metropolitan area.
We run a midwifery group practice, so MGP. That's a service where women are allocated a primary midwife to look after them throughout their pregnancies. It's care from a known midwife, which is shown worldwide to be the best evidence-based practice. Being able to give that individualised care, being part of the community, being with the women in our community is awesome. We work in very close in multidisciplinary teams, so the doctors are very much involved in helping us with our midwifery care if women have got complications or need assistance during birth. They're here 24/7. It's wonderful for women to be able to birth locally and have their babies in their community.
The opportunities to get your extra competencies, for example, IV cannulation, catheterisation. Usually that's quite a process in metro hospitals, but here you get ample opportunities to practice. First 6 months you start out on the ward just while you build up those core skills, but from there they might ask you to go over to ED, or in my example I had quite an interest in theatre, so I wanted to go over there and they're helping me sort that out. After your first year as well, there is the transition to specialty program that WACS offers, so you do 12 months of ward nursing wherever you are, and then you can apply to a specialty area like aged care, palliative, theatre, infection control. There's all sorts of options for you to go out and specialise once you've done your first year. That was one of the main draws that got me to apply here for my grad. Having an interest in theatre means that I can do my 12 months here, then jump straight into that.
I just saw the ad that they put out for the transition to specialty program, and there was cancer services there, and that was an area that I was interested in, and so I just took the opportunity and I was like, oh, we'll try it out, and it's been really good. Get to do a variety of different things which you wouldn't really see on the ward, treating lots of different kinds of cancer. We do chemotherapy, immunotherapy. I got the opportunity to go to Northam for a couple of weeks as well and see their chemotherapy unit and work with their doctors and haematologists. I also went to Fiona Stanley for a couple of weeks as well. Lots of exposure and opportunities.
So we have the tele-chemo team here. So we see the patients, the doctor sees the patients on the TV, and we give the chemo, but we're very well supported by the cancer services team. Very experienced people that we can just pick up the phone and ask a question whenever we need to.
So the nurses that are coming here are put into an orientation program. Given their mentor, we've got staff development, online learning, and access to all of our online learning portals as well. But at the end of the day, we support the new nurses. They're going to be our future generations. We involve them so that way they can understand how we run here, how a controlled environment is run, and hopefully they can be supported enough to step up into that more nurse-led role.
I'm a nurse from India, so I worked in ICU for a long time. That's my experience. Then I came with my daughter. She was only 3.5 years old, and my husband. She done all her school. Now she finished this year. She finished her year 12 in Narrogin. Yeah, she did really enjoy the Narrogin High School here. She's doing medicine now in UWA.
So it's a lovely town, it's got beautiful old homes. It's got lots of character. There's lots of activities, lots of sporting activities. The sporting facilities are all really first class. Yeah, it's a lovely place to bring up children. It's quite safe. They have an independent grocery store as well as a Coles supermarket. Got a lovely bakery. Vietnamese bakery, lots of cafes, yeah, beautiful homeware stores. Whatever you can get in Perth, most of the time you can get here.
It's so close to Perth, it's so close to the southwest. It's not a chore being here. It's people will go to Perth for dinner and then come home. So I think we're really lucky. We're really well placed here.